Hello, friends. Steve Brock here. We'd like to wish you a happy and safe 4th of July from us here at Brock Safety Consultants. What I'd like to talk to you about today are prevention, education, assessment, treatment, and care of burns, particularly related to fireworks related injuries. Last year alone, there were 14,700 people seen in emergency departments across the U.S. due to fireworks injuries. There were 11 deaths. 32% of those injured or killed were between the ages of 25 and 44. And 24% of those killed or injured were between the ages of 15 and 24. Might be something to think about before we let the kids, especially those in the 15-year-old area, go out and play with fireworks. The most common injured body parts include the hands and fingers, which were 36%. Head, face, and ears accounted for 22%. The most common type of fireworks related injury, as you can guess, burns, which were a result of 37% injuries due to fireworks in the year 2024. This is provided by data according to the U.S. Centers for Disease Control. So let's get right into it. Burns are tissues injuries caused by heat, electricity, or chemicals. Burns are injuries to the soft tissue, the skin, other parts of the body, due to heat, electricity, or chemicals. This session focuses on heat-related trauma subsequent to blast and or burn injuries, and first aid care in the context of Independence Day. The key biggest factor when it comes to fireworks related injuries, educate and prevention. If we can educate, we can continue. You might see educational information throughout different places, search for it all over the web. But if we don't get it out there, we're not going to prevent it. First degree burns are known as superficial burns. They affect only the outer layer of the skin, which is known as the epidermis, and they cause redness and mild pain. Causes of heat burns include direct contact with hot surfaces. We can see how it can happen today. Steam or scald injuries, and open flames and fire. Well, oftentimes a campfire comes along with fireworks display. So what do you want to do for first aid for minor burns? First, you want to ensure scene safety before you ever approach that victim. Ensure scene safety, whether it be a second degree, third degree, first degree, it really doesn't matter. If you're not safe, then you're putting yourself at risk also. You want to cool the burn under cool running water. There's a key word, cool running water, not cold water, for at least 10 minutes or until the pain subsides. And that's another priority. First, you want to, whether despite the thickness or the size of the burn, you want to scene safety and cool the burn as soon as possible. If running water isn't available, apply cool, clean compress. Avoid freezing temperature. Freezing temperatures can cause necrosis of the surrounding tissue and obviously it would die. You might also consider a commercial cold pack, which we carry here at Brock Safety Consultants. You can get them. We are open 24/7 throughout the holiday weekend. If in the case of emergency you need some, we have many cases in stock. Just give us a call. And we'll give you that information a little bit later. And then finally, you want to dress the area. Certainly, you want to use try to use rubber gloves, or not rubber, but latex glove, not nitrile gloves. Excuse me. Again, non-stick, sterile dressing. Let me turn that up where you can see it better. And then here's the bandage to bandage it in place. Okay. Hopefully you can see that all right. Second degree burns are also known as partial thickness burns. They have deep blisters and a moist appearance. So if you can imagine, second degree burns, partial thickness burns, is deep through the epidermis and into the dermal portion of the skin. So parts of the second degree burn may cause you pain, and then surrounding areas may not be so painful. So as you go deeper into the skin, it's going to burn that much more. And as you come out and you circumference away from the area, then that's not going to be as cool or as hot. I'm sorry. Often the hands, face, and groins are affected by second degree or partial thickness burns. The skin may appear dry or leathery. And finally, let's talk about third degree or full thickness burns. Burns can be of almost any degree. Burns can be life-threatening. One of the biggest things, one of the most important takeaways I want you to take away from this today is prevent infection. Oftentimes, infection can kill individuals even from a minor burn. Third degree full thickness burns extend all the way through the skin layers. So the epidermis, dermis, and subcutaneous. White or charred appearance. Now here's the difference between second and third degree burns. Third degree burns may not always hurt because you're killing the nerve endings. But as you go out away from the center of the burn, then you have second degree burns or superficial burns. That's where you get the pain. And the first degree, even out farther than that. You want to make these people as comfortable as possible. You want to, one thing I want to, it requires immediate advanced care. And one thing I want to certainly alert you about is immediate call 911. Burns covering larger than 3 inches in diameter or involving critical sites such as the hands, the face, the groin are considered serious, even if they appear minor. Let's talk about that again. Burns to the hands, the face, and the groin are considered serious, even if they appear minor. First aid for serious or fire-related burns. First aid for serious second, third degree burns. If the clothing is ablaze, have the victim stop, drop, and roll. Cover them with a wet blanket. Stop the burning process. Remember, scene safety and stop the burning process as quickly as possible. You can cover them with a wet blanket to help stop the burning process. Once flames are out, remove the blanket and any non-adherent jewelry, because while the clothing may not be stuck now, it may be later on. So remove any clothing, jewelry, as much as possible when it comes to severe burns. Cool the burn with cool water for at least 10 minutes, Remember, we said cool water, not freezing cold water. And we know why now because we discussed that. Cover with the dry, nonstick, sterile, or clean dressings. And again, we presented those. Wrap the victim in a dry, warm blanket. Dry, warm blanket. Good example are these sterile burn sheets right here. We can either use these to cover and help prevent infection of the body while we cool the body, or we can cover them with this to prevent shock. So, how do we go into shock from burns? Well, burns cause us to lose fluids. There's such a thing as hypovolemic shock, or shock due to loss of fluids, blood, etc. And then, dependent on the severity of the burn, it also may affect the nervous system within that area that's burnt. Wrap the victim. We talked about that. Call 911 or transport to a healthcare facility immediately. Question yourself before you attempt to transport someone to via private-owned vehicle. If this person goes into cardiac arrest or if something bad happens, there's not as much room to work on that victim in a vehicle as there is in an ambulance. Plus, the paramedics are highly trained and able to handle such situations. So, can you get an ambulance there as quick as possible? And a lot of times, the paramedics are providing the same care to the victims that the doctors and nurses provide in the emergency department. So, injuries subsequent from fireworks. Let's talk about that. Fireworks-related injuries, not direct to burns, include injuries to the eyes and the vision. To the eyes and the vision. Let's think about that. If something goes off, if you're lighting something, igniting something, and it goes off in your face, could very well damage an eye, possibly even permanent damage. Skin and small soft tissues, well, very obviously with the burns. Hands, fingers, toes, and feet. Hands, fingers, toes, and feet. So what's a child's favorite thing to play with on the 4th of July? Sparklers. Did you know sparklers reach a temperature in excess of 2,000 degrees? Did you also know that 2,000 degrees is hot enough to melt gold? So a lot of times we see children with sparkler in hand waving around an excess of 2,000 degrees in temperature. What else do they often do? Often lay them down or throw them down on the ground. Can you imagine how many feet get burnt that way? My suggestion is to have a gallon bucket of water, dip the sparklers directly into and leave them in that bucket of water. Depending on the explosion of the firework, it could blow off fingers and toes as well. Another thing is head trauma or concussion. Dependent again on the severity of the fireworks, it can knock you for a loop and knock you, on your head. And you have what's called coup contra coup injuries. Coup injuries are when the skull hits its surface. The brain, as Newton's theory of relativity says, an object in motion remains in motion unless acted upon by outside force. So your outside force may be a concrete wall. Here's your skull. Here's your brain. So you've got very little room in between. Smack, you've hit the skull, and the skull's hit the brick wall or whatever else it may run into. So let's talk about fireworks injury prevention. We won't have to experience this. We won't have to go through all this. Thousands of dollars are spent annually due to fireworks-related injuries. So prevention. Wear protective eyewear and non-flammable gloves. Always wear closed toe shoes and full-length clothing. By full-length clothing, I'm referring to a long sleeve shirt, long pants. Always make sure that you're wearing protective footwear. Avoid alcohol when handling the fireworks. Certainly, please keep your eye on children if you intend to allow the children to play with the fireworks. Like one device at a time, then move back. So many times we see people tying surplus of firecrackers together to get the boom, boom, boom effect. A lot of times they can lose fingers and toes that way. Never relight duds or handle unexploded fireworks. Never relight duds or handle unexploded fireworks because they might just in turn go off on you. Soak use sparklers, as we mentioned, in water and keep them there. Keep children away from ignition areas. We want to do everything to certainly try to protect these individuals as much as possible. At Brock Safety, we know our first responders can't afford delays. I served 37 years as a paramedic in law enforcement as well, and as a firefighter. When you need your supplies, you need your supplies. Whether you're responding to a call, staging at an event, or holding down the station, we're right there with you. We can immediately deliver most of the items that you may need either to your scene 24/7 or to your fire station. What you get from us, we offer fast, no hassle restocks. We offer the most quality supplies you trust. Having been there again, we know that the products that we use to care for our victims have to be of the best quality. Another thing that we insist upon from our personnel is friendly service that never clocks out. We provided you service and care as paramedics, law enforcement officers, EMTs, firefighters over the years, and you've trusted us. We hope you will continue to trust us with our company that's involved from our years of experience, Brock Safety Consultants. Brock Safety Consultants offers no delays, just dedication. Imagine, heaven forbid, you have a mass casualty incident and you thought you had enough supplies. You can call us at 765-792-0365 and we'll deliver to you almost immediately, 24/7. As the fireworks light up the sky tonight, we're standing by 24/7, ready to support our emergency responders with fast, reliable access to critical medical supplies. We've got your back so you can protect ours. Here's to a weekend filled with pride, safety, and celebration. And again, if you need supplies delivered immediately, we can get them to you just by dialing 765-792-0365. Again, 765-792-0365. And again, God bless America and happy Independence Day.